As parents, we just have, an instinct to protect our babies, of course, and keeping them as close to us as possible feels very much like the way to do that. I think, probably pretty universally, right? And especially if in our own families, I think this is related, but in our own families, we saw things being done a certain way, with our families, our parents and our grandparents and everyone around us with babies. So I think that the safe sleep recommendations, often the way they're taught, can feel really just unnatural and not normal and really not safe, I think, to lots of families from all different backgrounds. A lot of times, even if families are completely open to them, or even if they feel like, yeah, sure, I want to do things that way, all families don't have the same resources, so families may not have access to a crib or a pack and play or even a bassinet, or they may not have access to the space to put that. I talked about in the video, sometimes families have a place to put the bassinet, but it's on a different, put the pack and play, but it's on a different floor of the house than where the rest of the family sleeps, and that doesn't feel convenient or comfortable or safe. So I think the safe sleep recommendations are often communicated with the assumption of that everyone lives in this kind of house where they have this many rooms and this kind of space, and that's not the reality for a lot of different reasons for a lot of families. And then I also think, and I talked some about this before in the video too, but just, the recommendations may not be communicated in culturally appropriate ways, and that can be all kind of things from, just are they even taught in a language that is the family's first language, do they, are we using materials that show families that look like them and families they can identify with? I talked about this too, what's the language like in terms of, are we always talking about mom and dad do this, and does that make sense for a single parent or for same gender parents or for a parent who's transgender and non-binary, or for grandparents who are doing the parenting? Are we making sure that we're really talking to that family? I think a lot of times that doesn't happen, and so that can be just sort of another layer of disconnect for the families. Well, I do think sometimes, because it's kind of communicated oh, of course you have your baby's room down the hall with their crib in it, and that's where your baby sleeps. And for a lot of families, that's just either not something that's even possible for them or not something that they want at all. And so it feels like, well, if I can't do that, I can't do any of the things. And so, kind of that's like all of the recommendations are kind of out the window. I also think that a lot of families, might, be really clear. They might know that they're going to bed share because that's the way that feels best and safe and most comfortable for them, and that's how they've done it, and their parents did it, and their grandparents did it. But maybe, no one has ever discussed with them that there are different ways to do that and that there are safer and less safe ways to do that. So, it just kind of feels, I've had families say to me well, I know I sleep in the bed with the baby and I know you're going to tell me I'm not supposed to do that. And so, we can just move on, but that no one's had kind of a conversation about well, how do you sleep in the bed with the baby? Are there ways that you could sleep in the bed with the baby that could look different than the baby's under all the quilts and blankets and pillows with you, and the dog is also there, and the other 5 siblings, or whatever, or they're next to the wall, or so I think that's a thing that a lot of times no one's ever gone into discussing what are the safer ways to bed share. Yeah, I think those are kind of some big ones. Oh, I guess I would also say the blankets. Blankets, and maybe not as much anymore, but I still see this with the crib bumpers. Even families who are doing, they have a crib and they have the crib all set up, but what we see in stores and in the media all the time is the crib is sold with the pretty little crib bumpers that go around the outside, and then the matching blanket that goes with it. And so I think a lot of parents, you know, who might feel like, yes, I'm doing the safe sleep recommendations and I have the crib bumpers to keep my baby safe in the crib and I have the nice blanket to keep them warm. And, you know, because that's the way that like stores persist in selling things and media persists in showing things, that I think to a lot of parents, they feel like those are the recommendations. So that's kind of a separate issue, but I think separate ways that it can be misunderstood or miscommunicated. It's hard to say. It seems like there's a lot, from my perspective, or at least from what I see, which might be really different from other perspectives. I feel like there's a lot of messaging that happens a lot for parents, and to parents, at parents, around parents. So I guess maybe just like the way it's done kind of is the issue. So, you know, talking about risk reduction, but, you know, and it's so hard because of course no one ever feels like there's enough time, but starting from the place of, you know, what did you learn about safe sleep? You know, maybe, you know, what's traditional in your culture or what's normal in your family, and, you know, what feels best and right for you, and talking about the reasons behind that instead of like, you know, this is the way you're supposed to do it. And, you know, taking the time to like hear like, oh, these are my concerns, and how could we maybe address things so that we could use these recommendations in a way that actually fits with your concerns. I also think, and this is just like my opinion, but I do feel like at least sometimes there's a tendency to want to do this education by scaring parents into doing it the right way. So, you know, like talking a lot about things like infant deaths. And, you know, and maybe that is useful from my perspective. I feel like when people get scared, it's really hard to take in new information or make different decisions. So I feel like I really prefer to talk about it from a place of like validating and affirming, like you want to keep your baby safe and you want to do it in the best possible way. And so let's decide together how to do it in the best possible way, instead of talking about things that sound really scary, like babies dying. Yeah, I think I try so hard just to, you know, not assume anything about parents other than that they are parents. You know, so talk about, you know, talking generally and specifically often about parents rather than about moms or moms and dads. You know, so going into any interaction with parents and trying to use that word parents as opposed to using the word moms or dads, you know, until, you know, obviously if I'm in a particular, you know, situation with a family and they've told me, you know, this, I'm the mom, this is the dad, then of course I want to use the language they use. But, you know, starting out from that like place with, you know, more neutral assumptions. And I think, you know, when in the places where we have control over, and thankfully there are a lot of great resources now about like, you know, how clinics can design forms, or, you know, how home visiting can design forms or whatever. But you know, thinking about like when are the first times we're asking parents about their families, and not just saying like everybody's, you know, name and birth date, but, you know, what are your pronouns, and, you know, what is your parent name? What do your kids call you? You know, so like, you know, are you being called mom? Are you being called mama? Are you being called papa or mappa or something else entirely? You know, and like being as much as possible, like providing the space for families to answer those questions, and then making sure that we use that information appropriately, you know, so we use the pronouns they give us or the parent names they call us, they tell us. And, you know, so like that we can practice doing that so that it doesn't feel awkward and like we're stumbling. And then, you know, and when we make mistakes, you know, which everyone does all the time, you know, just like correcting ourselves and moving on, instead of, you know, spending a long time apologizing or like saying like, this is strange, or this is difficult for me, or this is so hard because I'm used to doing it this way. So just, you know, really as much as possible normalizing for everyone like that they're all different kind of families, and, you know, that parents identify in all different kind of ways, you know, so that I think it can be particularly like with pregnant parents, it can be particularly, really easy to say like, okay, look at this group of pregnant moms, or look at this group of pregnant ladies. And, for the majority of people that might feel comfortable and appropriate for them. But there may be parents there who that doesn't feel comfortable and appropriate for, and we may not have any way of knowing by looking. So, as much as possible, trying to normalize language like parents. And then like around lactation and infant feeding. And thankfully, there are also, people are doing a lot of work around changing that language too. But, I think for a lot of people, it feels really normal to just use the word breastfeeding all the time. But, for some parents, that word does not reflect their experience. So I feel like I use the word nursing a lot because that can feel like a more neutral word. I think it's also good to think about like, words that are taking into account all the different ways that people can feed their babies human milk, because that's also, this is a little off topic from what you said, but because it's not just related to gender, but I think because it can feel like such a fraught topic in the larger culture, around, we all know that giving babies human milk is the healthiest thing, but there's lots of different ways parents do that, right? So somebody may be exclusively pumping, so they wouldn't see themselves necessarily as covered by the term breastfeeding, but they're still giving their baby human milk, and they're doing an incredible amount of hard work to do that thing that's going to be healthiest for their baby. So trying to, and I feel like sometimes that just means I talk a lot and use a lot of extra words, but human milk feeding is a term I feel like that a lot of people use that covers a lot of that, that covers breastfeeding, but also chest feeding or body feeding, which some parents, trans or non-binary parents, might be more comfortable using because, breast might not be a comfortable, safe word for them. But also, that can cover things like pumping and bottle feeding human milk to infants. And so, sometimes it just means like using all of those words, breastfeeding or chest feeding or pumping, or, all of the different ways that we feed human milk to infants, which is ultimately, the goal is about, giving that milk to those babies as a way to help them be healthy. For me, like such an important part of my continuing education is just trying all the places I can to listen to parents, like to listen to all different kinds of parents, and parents whose experiences are different than mine, so to listen to Indigenous parents and to listen to trans parents and to listen to, just as much as possible, in all the places I can. So whether it's like, in online forums or, just like talking to parents at the park or whatever it is, just trying to listen to what their experiences are and not come with assumptions. And I feel like that's so much of what I feel like is the most important continuing education for anyone who's working with parents and families and babies, and I certainly know it is for me. And like, so much of what I learn is just from having those opportunities to have parents and children, be honest and open and getting to listen. So.